Do you know that about every 3 seconds, someone in the world develops dementia? That number is not just a statistic. Behind it is a mother who begins to forget her daughter's name, a grandfather who gets lost on the way home, a mind slowly fading. What jolts me most, and why I am speaking with urgency today, is that part of this tragedy may be preventable. If you are over 60, if you care for aging parents, or if you simply want to protect your clear thinking in the years ahead, stay with me. A medication that seems to calm a minor symptom can quietly speed up problems with memory, reasoning, attention, and independent living. That is not fear-mongering. It is why major medical groups now ask older adults and their clinicians to review medicines that can cloud the brain and to consider safer options whenever possible. I will lay out 4 medication groups most closely linked with higher dementia risk in older adults. Just as important, I will point you to safer, evidence-based alternatives to discuss with your doctor. The final group is both the most common and the most concerning. This matters for everyone, and it is especially relevant to men who may use medicines for sleep or urinary symptoms that add to anticholinergic burden and impair thinking over time. As always on Men's Health Advice, knowledge is not only power. In this case, it protects dignity and day-to-day freedom. I will draw on published research and guidance and share one hard truth many clinics still overlook. I will also give you the best defensive habits to keep your brain resilient as you age. First, what exactly is dementia, including Alzheimer's disease? Understanding the problem is how we defend against it. Dementia is not one illness. It is a syndrome, a set of symptoms that include a decline in memory, thinking, and judgment severe enough to interfere with daily life. Alzheimer's disease is the most common type. Importantly, dementia is not an inevitable part of normal aging. National Institute on Aging +2, CDC +2. Imagine your brain as a vast library holding millions of books. Every memory, word, and feeling has its place. In dementia, the librarians, the neurons, and their connections begin to fail and disappear. Signals between brain regions break down. With Alzheimer's disease, neurons lose function, connections are cut, and cells die, which is why short-term notes go missing first, then names and faces, and later the ability to follow a conversation, prepare a meal, or find your way. National Institute on Aging. This decline does not happen all at once. It can be quiet and gradual, easy to dismiss as normal aging until it is advanced. The painful truth is that common medications can accelerate this process by blocking brain chemicals needed for attention and memory, especially drugs with anticholinergic effects. That is why leading geriatric guidelines urge older adults and clinicians to tally total anticholinergic burden and deprescribe when possible. In a moment, we will open the medicine cabinet, face what we are using, and map out safer paths forward together. Part 1. Benzodiazepines, GABA overdrive, the silent enemy resting beside the bed. I am speaking about sleeping pills and long-term anxiety medications, benzodiazepines. If there is one group of drugs that reflects blind trust in modern medicine, it is this one. Lorazepam, diazepam, alprazolam, and clonazepam. These names may sound familiar, even comforting to some. They are the pills that promise a good night's sleep, ease chest tightness, and calm the nerves. But what is prescribed as short-term relief often turns into chronic dependence. Even at low doses, long-term use can exact a heavy price on the brain, the very functions that define us as human: memory, judgment, and identity. Benzodiazepines act on the GABA system, a neurotransmitter that slows down brain activity. It is like dimming the lights in an overly bright room, which is why these drugs make you relaxed, sleepy, and calmer. The problem is, the effect is not selective. Alongside reducing anxiety, they also slow essential cognitive processes like focus, forming new memories, and holding on to what you have learned. With prolonged use, these effects accumulate. This broad inhibition impacts critical brain circuits for memory and decision-making. The hippocampus and prefrontal cortex, areas responsible for encoding memories and managing executive functions like planning and problem solving, are especially rich in GABA receptors and therefore strongly suppressed. Over time, the brain adapts by lowering its own GABA production and reducing receptor sensitivity. This explains why suddenly stopping these drugs is so dangerous, causing withdrawal seizures, and why cognitive decline may persist long after use is discontinued. A landmark 2014 study published in the British Medical Journal followed nearly 9,000 older adults. It found that using benzodiazepines for 3 months or longer was linked to a 51% higher risk of developing Alzheimer's disease. The risk was greater with longer use and extended release forms of the medication. There is another hidden cost. Benzodiazepines alter sleep cycles. While they help you fall asleep, they suppress deep sleep, the stage when the brain clears toxins, consolidates memory, and restores connections. Sleeping with benzodiazepines is like sleeping with the lights on. You rest, but you do not truly recover. Over time, this lack of restorative sleep adds to memory and cognitive decline. The American Geriatric Society includes benzodiazepines in its Beers criteria, a widely cited reference in geriatric medicine that lists potentially inappropriate medications for older adults. For many years, these drugs have been on that list. The AGS strongly advises against their use for insomnia, agitation, or delirium in seniors because of the heightened risk of memory loss, falls, fractures, and motor vehicle accidents. Let me share the story of Robert, a 74-year-old widower living alone. He developed insomnia after his wife passed away. His doctor prescribed lorazepam. At first, it was a blessing. He could sleep. He felt able to continue with life, but he was never told that this was meant only as a short-term solution. Months stretched into years. Robert became less engaged. He began forgetting simple things. One day, he got lost on his way to the grocery store. His daughter feared it was Alzheimer's. But when the doctor reviewed his medical history, the link became clear. Robert had been taking benzodiazepines every night for 3 years. The very medication that had once comforted him was now eroding his independence. So, what should we do? Must we simply accept anxiety and insomnia as inescapable parts of life? The answer is no. But the solution is not to endure in silence. The key is to know there are alternatives. And first of all, never stop these medications suddenly without medical guidance. Benzodiazepines create physical dependence. Abrupt withdrawal can cause severe anxiety, extreme insomnia, and even seizures. Tapering must always be gradual and closely supervised by a doctor. The essential step is to have an honest discussion with your physician. Ask, "Doctor, do I really need to keep taking this drug? Can we start a plan to safely taper off?" The World Health Organization has long warned against prescribing benzodiazepines for extended periods. They recommend limiting their use to no more than 2 to 4 weeks for severe anxiety or insomnia, followed by a cautious reduction plan. There are proven alternatives for managing insomnia. Cognitive behavioral therapy for insomnia has shown better long-term results than pills. Other options include melatonin, sleep hygiene strategies, relaxation exercises, and guided meditation. For anxiety, newer classes of antidepressants are considered much safer for cognition. And beyond medication, there are non-drug tools: physical activity, social connection, and emotional therapy. The goal is not to eliminate every trace of anxiety or to sleep like a child every night. The real goal is to protect the mind and preserve memory, which are worth far more than any artificial night's rest. Here, we have revealed the first hidden enemy, an agent that offers comfort but quietly undermines the very mind you want to safeguard. Part 2. The memory thief. Hidden in everyday treatments. This next group of medications is among the most dangerous. They make no noise, create no scandal, yet they appear in dozens of products that millions of older adults take every day without realizing the cost. And the cost is high. It is called cognitive decline. It is called dementia. Did you know that some common antihistamines, bladder control medications, motion sickness pills, and even certain antidepressants share the same toxic effect on the brain? All of them interfere with a vital neurotransmitter called acetylcholine. This chemical messenger is essential for attention, learning, and memory formation. Without it, nerve cells lose their language. These drugs, known as anticholinergics, cut off that communication channel day after day, year after year. Oxybutynin, tolterodine, diphenhydramine, amitriptyline. These may sound like technical names, but they often hide behind familiar labels. Sleep syrups, over-the-counter allergy pills, or bladder control tablets. If you look closely at the instructions, you may find one key phrase: anticholinergic effect. Acetylcholine is not just another messenger. It is the conductor of the brain's orchestra, ensuring that all sections, sensory input, memory retrieval, focus play together in harmony. Anticholinergic drugs block acetylcholine receptors, leaving the orchestra unable to follow the conductor's lead. This disruption can be measured. Using advanced imaging such as PET scans, researchers have observed that people with a high anticholinergic burden show reduced glucose metabolism in the brain. This decline in brain activity is also seen in the early stages of Alzheimer's disease. Long-term use has been linked to brain shrinkage, especially in the cortex and hippocampus. The key concept here is anticholinergic burden. The danger does not come from one pill alone, but from the cumulative effect of many, like allergy medicine, bladder treatments, and tricyclic antidepressants used together. The evidence is clear. A large-scale study published in JAMA Internal Medicine in 2015 followed more than 3,400 adults aged 65 and older for over 7 years. The results revealed a strong dose-response relationship. The higher the cumulative use of anticholinergic medications, the greater the risk of dementia. Taking high-potency anticholinergic drugs daily for just 3 years was linked to a 54% higher risk of dementia compared with no use. Most concerning of all, the damage did not simply disappear after stopping the medication. The effects can linger, much like cigarette smoke that clings permanently to the walls of a house. Consider the story of Mary, a 76-year-old woman. She suffered from urinary incontinence and was prescribed oxybutynin. At first, the medicine seemed to restore her freedom. She could go for walks without fear. But months later, she began repeating the same stories and confusing dates. Her children thought it was just aging, until one night she no longer recognized her own home. At the emergency room, the diagnosis was clear: moderate cognitive impairment. One of the most likely contributors was her medication. The very pill that gave her security was stealing her clarity. I am not suggesting that you must live with urinary incontinence or untreated allergies. What I am saying is that there are alternatives, and you deserve to know them. First, review your medications. You can search online to check whether they carry an anticholinergic burden, or ask your doctor or pharmacist directly. Second, start an open conversation. Ask, "Doctor, this drug has anticholinergic effects. Is there a safer option for my memory?" For example, for overactive bladder, there are beta-3 agonists like mirabegron. These work through a completely different pathway and do not interfere with acetylcholine. Their safety record for brain health is much better. The Alzheimer's Association acknowledges the close connection and advises both patients and doctors to carefully review medications, reducing or replacing strong anticholinergics whenever possible. There are also non-drug options. Pelvic floor exercises, bladder training programs, and simple dietary changes such as reducing caffeine or alcohol can make a difference. For sleep, instead of sedating antihistamines, safer alternatives include melatonin or behavioral strategies. The message is clear: not everything that helps the body respects the brain. And when it comes to memory, independence, and dignity, the hidden cost can be devastating. Now, we have exposed two culprits. One that lulls us into artificial sleep, and another that silences the very thoughts within us. What comes next has an even deeper impact. Part 3, the double-edged blade for inflammation. This group of medications is famous for being almost miraculous. If you have ever faced asthma, severe arthritis, or a serious allergic reaction, you likely know their near immediate power. I am talking about systemic corticosteroids such as prednisone, methylprednisolone, and dexamethasone. Within hours, they can quiet inflammation that would otherwise be disabling. But this benefit has a darker side, and in the aging brain, that side can carry serious consequences. Yes, corticosteroids save lives, yet they can also alter the chemical balance and structure of the brain, increasing the risk of cognitive decline and dementia when used for long periods or at high doses. The problem has two parts. There are direct biological effects, and there are indirect effects that disturb many body systems and with them brain function. Corticosteroids like prednisone are synthetic versions of cortisol, the body's primary stress hormone. The hippocampus, the memory center of the brain, has one of the highest concentrations of glucocorticoid receptors in the entire brain. At normal levels, cortisol helps regulate memory. With prolonged exposure to high corticosteroid levels, these receptors are overstimulated in a harmful way. Reduced neurogenesis. New neuron formation in the hippocampus is suppressed, a process that is essential for learning and mood regulation. Synaptic pruning. Existing synaptic connections are weakened and eliminated, making communication between neurons less efficient. Increased vulnerability. Hippocampal neurons become more susceptible to other injuries such as stroke or uncontrolled blood glucose. This chain of events explains measurable changes. Long-term steroid therapy has been linked to hippocampal atrophy on MRI. In addition, the metabolic disruption they cause, including hyperglycemia and insulin resistance, directly contributes to cerebrovascular injury and neuroinflammation, both major drivers of vascular dementia and Alzheimer's disease. Multiple studies support this link. A 2021 study in BMJ Open that included more than 222,000 users found that systemic glucocorticoid use was associated with significant changes in white matter integrity and reduced gray matter volume, which provides a structural basis for observed cognitive and psychiatric side effects. Major rheumatology and pulmonary organizations, including the American College of Rheumatology, now emphasize using the lowest effective dose for the shortest possible time. They strongly support steroid-sparing agents, meaning other immunomodulators or biologics, to limit chronic exposure. Now to the indirect consequences. First, these drugs shift metabolism, raising blood glucose and causing or worsening diabetes. Diabetes is a key driver of cognitive decline, even in people without prior history. High glucose injures cerebral blood vessels, produces microinfarcts, and fuels inflammatory processes that affect neural tissue. Second, they disturb sleep. Many older adults who take morning corticosteroids still experience insomnia at night. As noted earlier, chronic sleep loss prevents the brain from its nightly cleanup, clearing toxins, consolidating memory, and repairing structures. It is as if a city never manages to collect its trash. Third, they alter mood and cognition. Euphoria, irritability, anxiety, and confusion are common adverse effects. In older adults, these symptoms can be mistaken for dementia, or, when a vulnerability already exists, can trigger an apparent decline. Consider the case of Linda, age 78, living with rheumatoid arthritis. Her physician prescribed chronic prednisone. The inflammation eased and the pain subsided, but months later, Linda developed episodes of disorientation. She forgot appointments and left her grandchildren puzzled. Some nights she could not sleep. Other days she cried without a clear reason. The diagnosis was mild cognitive impairment. Many factors may play a role, but corticosteroids stood out as the most visible trigger. Her brain could not endure the daily hits. So what should we do when the medicine is necessary? The answer, as in all of medicine, is rarely simple. Prednisone is not the enemy. Uncontrolled, prolonged use is the enemy. Here are the essential points. Use the lowest dose that works for the shortest time that is practical. Ask your doctor whether a taper can begin now and whether there is a defined tapering plan. Explore alternatives. For autoimmune diseases, disease-modifying therapies may allow dose reduction or discontinuation. For asthma or COPD, inhaled corticosteroids are much safer. Minimize the impact. If you must continue, protect your brain on purpose. Maintain blood glucose control with an eating pattern that avoids ultra-processed foods. Reduce stress with mindful breathing. Safeguard high-quality sleep, even if that requires schedule adjustments or adding melatonin with medical guidance. Above all, check your cognition every few months. Early detection can change the course. Remember that corticosteroids are powerful allies, but they can become quiet saboteurs when use is not controlled. When memory, independence, and the ability to recognize your own family are at stake, is it not worth a deeper conversation with your physician? We have now covered 3 classes of drugs that present themselves as solutions yet may, without our noticing, become agents of mental fog. The final group is the most debated, the most common in nursing homes, and in my experience, the one that can accelerate dementia the fastest. Part 4, the pill that steals the will. This is perhaps the most difficult chapter because it addresses a practice so common that it has almost become routine in elder care. It often arises from exhaustion, fear, and lack of resources, but its consequences can be devastating. I am speaking about the use of antipsychotic medications such as risperidone, quetiapine, olanzapine, or even haloperidol in older adults with behavioral problems or dementia. These drugs work by blocking dopamine D2 receptors. While this may reduce symptoms of psychosis such as hallucinations or delusions, in a brain already damaged by dementia, the effect can be harmful. The first consequence is cognitive decline. Dopamine is vital for the frontal lobe functions that drive motivation, planning, and behavioral control. By suppressing dopamine, these drugs can cause profound apathy and slowed thinking, accelerating the symptoms of dementia. The second is drug-induced Parkinsonism. The same D2 blockade along the brain's motor pathways, the nigrostriatal system, can trigger stiffness, tremors, and severe slowness. This immobility predicts falls, infections, blood clots, and rapid loss of function. In addition, newer atypical antipsychotics, such as olanzapine and quetiapine, are known to cause rapid weight gain, insulin resistance, and diabetes, independent risk factors for speeding cognitive decline. Among older adults, especially those with dementia, these medications are often prescribed off-label as a quick fix to calm agitation or make behavior easier to manage. But the calm comes at a heavy price, often costing mind, independence, and in some cases, life itself. The Food and Drug Administration has issued its strongest warning, the FDA Black Box Warning, 2005. This was based on large randomized controlled trials, including the pivotal KDAD study, which showed a 1.6 to 1.7 times higher risk of death in older dementia patients treated with atypical antipsychotics compared with placebo. The causes of death were most often heart-related events and infections such as pneumonia. This is not exaggeration. In some cases, the risk of death doubled, and the risk of rapidly advancing dementia, falls, infections, and fatal strokes tripled. Consider the story of George, age 82, living with dementia in a nursing home. He had difficult days, often agitated and asking to see his late wife. Overwhelmed staff decided to give him a low dose of quetiapine. At first it seemed to help. George became quieter, calmer, but he also stopped smiling and no longer recognized his daughter. Within a month, he could barely walk down the hallway. Within 3 months, his condition declined so much that he was considered close to the end of life. The pill that calmed the moment erased the essence of who he was. So what should you do? This is the hardest, but also the most urgent conversation. If you have an older loved one with dementia who is prescribed antipsychotics, you must be their advocate. Ask directly, "Doctor, have we tried all non-drug approaches? What is the plan for tapering this medication as soon as possible?" Because alternatives exist, and the most effective step is to understand why the person is agitated or distressed. Are they in physical pain that has gone unnoticed? Are there sounds, lights, or stimuli they cannot make sense of? Are they bored, frightened, or lonely? Agitation in dementia is not simply a symptom to be silenced. It is a message to be interpreted. There are proven behavioral strategies, personalized music, a calm environment, emotional validation, gentle touch, and structured routines. These approaches require time, patience, and compassion, but they are far safer and, above all, more humane. Antipsychotics should always be the last resort, used for the shortest time possible, and always with a clear plan for discontinuation. They should never be a permanent solution, never a shortcut to silence, because behind every effective pill lies a brain quietly fading and a family losing the presence of someone still alive beside them. Conclusion: take charge of your mind. We have traveled a difficult path together. We opened the medicine cabinet that many of us trust, and we uncovered 4 hidden culprits silently contributing to cognitive decline: benzodiazepines, sleeping pills, or anti-anxiety drugs that can slowly dim the light of clear thought. Anticholinergic medications. Found in common bladder and allergy treatments, they cut off the brain's communication lines as if pulling the plug on its electrical system. Systemic corticosteroids. They reduce inflammation, but without careful strategy, they erode the hippocampus and emotional balance. Antipsychotics. Quick fixes for dementia-related behaviors that too often become shortcuts to disconnection and loss. I do not share this to frighten you. I share it so you can take control. We live in a healthcare system that often rushes to prescribe the fastest treatment without many questions. But you are not a passive patient. You are the guardian of your own mind, or the advocate for your parents, your grandparents, or those who can no longer speak for themselves. Now, you hold something that many do not: knowledge, awareness, and power. Building cognitive reserve is your strongest defense. Cognitive reserve is the brain's ability to resist damage and continue functioning well. A strong reserve can help protect the mind from the effects of aging, illness, and even harmful medications. The best way to build cognitive reserve is through lifestyle. Begin with the Mind Diet. This plan blends the Mediterranean and DASH diets, with special focus on brain-protective foods such as leafy greens, berries, nuts, olive oil, and fish. Research shows it can significantly lower the risk of Alzheimer's disease. Next, increase physical and mental activity. Exercises that raise your heart rate, boost blood flow to the brain, and stimulate the release of brain-derived neurotrophic factor, BDNF, a nutrient that acts like fertilizer for neurons. Engaging in mentally challenging activities such as learning a new language or playing an instrument builds new neural pathways and strengthens brain resilience. If this video has helped you, do not keep it to yourself. Share it with your sister who cares for your mother, with the friend who has relied on sleeping pills for years, or with your group at the senior center. Every time someone sees this knowledge, it has the power to change a life. Subscribe to Men's Health Advice to follow the next lessons we share. And I want to ask you one final thing. Leave your experiences in the comments. Have you or your loved ones used any of these medications? How have you seen them affect daily life? Your stories will help others and remind us that none of us are alone. Many of us are ready to stand for a wiser, clearer, and more dignified old age. Take care of your mind. It is the home where everything you love resides, and you deserve to keep it shining bright for the rest of your life.